the word burnout all the time, whether it's posts on social media or some other type of content. Maybe we're looking at something else online and it's a cure for burnout or how to prevent burnout or whatever you do. Here's the signs to acknowledge that burnout is real. And all of these are great things. But what I don't hear enough about is the real, true cause of what burnout actually is. So today I'm bringing on a professional who knows all about burnout, and she's actually the author of Moral Injury Healing the Healers. So let me introduce to you my next guest. Dr. Jennie Byrne is a healthcare advisor, entrepreneur, and practicing psychiatrist with expertise in neuroscience and mental health. She advises companies like LunaJoy Health, PsychNow, and NewCo at Healthcare Foundry, which are transforming mental health care through technology and innovation. Dr. Byrne is the co-founder of Belong Health, a company dedicated to supporting vulnerable populations, and the author of Work Smart and Moral Injury, Healing the Healers. With a background in both clinical practice and leadership, she focuses on improving healthcare delivery and supporting physicians facing mental health challenges. Dr. Byrne, welcome to the show.
Hey there, Tara. Thanks for having me.
You are so welcome, and I'm really excited to dig into this because don't you agree? We kind of hear this word burnout just tossed around all of the time. Every time I look on LinkedIn, I hear somebody talking about burnout. But you're the first person that really talked about what it really is at its most granular level, which is why I'm so excited to talk to you today. So welcome.
Thank you. And I'm really glad we're having this conversation as we're in kind of the midst of the winter holiday season, because this is a time of year filled with a lot of joy and happiness, but it's also filled with a lot of, painful memories, difficult situations with families, and it's also a time of reflection. So I think it's a great time of year to talk about this topic.
Yes. And I have to assume that you have a MD and a PhD. You're very, very qualified. And you work with a lot of doctors, they're friends of yours, right? Friends and colleagues. And I know a lot of doctors myself, right? And if you know doctors and you've interviewed them and talked to them on a real one-on-one personal level, so many of them look like the life has been taken from their bodies, Jennie. This is a real epidemic. And I'll be fair, it's not just in healthcare, although I see it even more prevalent in healthcare. Don't you agree?
Couldn't agree more. That was really what got me curious to write the book, was exactly what you said. All the conversations I have with other clinicians, physicians, friends of mine, colleagues, and people I don't even know. And of course, like you said, on social media, everybody can see the statistics around, physician burnout, people leaving healthcare, physician suicides. Unfortunately, I just got a message about one the other day. So it's everywhere around us. And that's what got me really passionate about the topic. And I think most people listening probably have had that experience like you, of like being a patient, going to the doctor, or maybe your kid's doctor, your adult parents' doctor, and just they look like the life has been drained out of them. I think that's a good way to put it. I certainly have seen that in my own physicians who take care of me.
Wow. The thing about it is, we're all going to be patients at some point in time. We don't want to think about it, right? But ultimately, we're all going to be a patient. So this is something that's extremely relevant to, well, all of us. And doctors are unfortunately committing suicide at really high rates. It's the equivalent of a jumbo jet every single year. It's about 400 physicians, I could be wrong, please correct me, but that are taking their own lives. And it's because of burnout, right? Is it other things?
Yeah, so I think what I learned in interviewing and researching for the book was we use this term burnout to mean so many different things. Like you said, it's just everywhere in the press, almost to the point where it's lost its meaning because everybody is using it in different ways. And what they're using it for is they just have an emotional sense or a physical sense that something is wrong. And
Mhm.
so they're using the term burnout to describe what's wrong with them. But in fact, it may or may not be burnout. And it may be things like moral injury or even a trauma response. And so I felt it was really important to help people understand the differences because the way to heal the different issues is actually quite different. So burnout versus moral injury versus trauma, the way we heal from those things as human beings is actually very different. So if we're just trying to heal the burnout, which I think is what we're seeing, there were all these things around resilience and self-care and all this, right? But it doesn't seem to be working. And I think the reason they're not working is not because these aren't good things to do, but because we're actually trying to treat a different problem. And so we're using an incorrect method, which isn't leading to good results. And then you get more frustrated and more burned out and more traumatized and all that. So we're kind of making it worse. So I feel like we're kind of, like you said, at this pivotal moment of a clinician, what I call a crisis. And it's not just doctors, it's nurses, physical therapists, everyone that does clinical work. And if we don't address it, I'm a patient now. I don't know about you, but I'm already a patient. And like, I'm worried there's not going to be anyone to take care of me. And I don't really want robots doing all my healthcare. I'm okay with them doing some stuff, but I still want a human being to connect with me because I think that is healing, to have another human being to really care for you, and heal you.
Wow. Well, you mentioned something I think a lot of people aren't considering. So there's two things I just want to highlight. One thing is self-care, resilience. That sounds like a personal problem. When I think about burnout, and I think maybe some people listening to this, they hear the word burnout and it's often associated as a personal issue. That's that's not funny, right? But it almost sounds like it to somebody that's facing this. And maybe they think they're going crazy. Maybe people have told them, right? Hey, this is a personal problem. Why don't you practice self-care? It's not a personal problem we're talking about if this is a worldwide epidemic, which it is. Would love your thoughts on that
So
real quick.
true. And just think about as like a nurse, for example. I mean, I don't know if you know a lot of nurses. They're pretty tough. Nursing is hard work. To tell a nurse that they're not a resilient person is like
Yeah.
an insult, honestly. So here's how I would think about it is that burnout is, I think the best definition of burnout is that it is a state of mental and or physical depletion. So your energy stores have been depleted for some reason. There could be a lot of reasons that it's getting depleted. It could be individual. That's a contributor. If you're not taking good care of yourself, yeah, that will contribute. But what you're saying is kind of there are other things behind it. And I think that's the key pivot is to say, yes, we need to take care of ourselves as individuals. Definitely true. And that's not really the culture of medicine. That's not how we train. We're pretty stoic. We're supposed to be perfect all the time. So that's not very sustainable. But then there are all these systemic issues, which, if you go back and look at the history of healthcare and when it started to become industrialized, and if you listen to the word burnout, it's actually an industrial term,
Mm.
right? Light bulbs burn out. It's an industrial term, and the word implies that to solve burnout, you just recharge the battery or you go get a new light bulb and plug it in. So even the term burnout is an industrial term. And I think using that term sometimes makes things worse because it's also industrial. So if you understand the history of the industrialization of medicine, you can see how the environment for moral injury has arisen, right? Because there's a couple factories, but when you talk to doctors or others, you hear the same thing over and over again, which is, I don't want to feel like a cog in a machine. I
Mm.
literally heard that quote 20 times while doing interviews, the same quote. people feel like a cog in a machine. The solutions that are being sought in the healthcare setting are typically operational. They are trying to make it better. So by focusing on fixing the electronic health record or having a scribe or making it easier for the doctor to be productive, we are inadvertently fueling the fire of the industrialization. And that is what at the core most people are hurting from. They feel like all of the meaning and human connection and the ability to do what they were trained to do, to take care of other human beings, has been stripped away. And they feel like a cog in a machine or a factory worker at the Ford factory, which, by the way, is where all this came from over 100 years ago. So
Wow.
so that's part of it. But then, people have been jumping to this narrative recently when they think about moral injury, saying, well, the clinicians are good and the executives are bad. It's this very like black and white narrative to say, well, and unfortunately, I don't want to go into the news, but there was just an executive that was actually just
Mm.
killed. And we don't know why, but it sounds like perhaps some of this feeling of like executives are bad and evil people may have contributed to this person's death. So this is the narrative that many people embrace because it's an easy narrative, but
Yep.
it's actually making things worse. And I know many executives in healthcare. I was an executive in healthcare, and I'll tell you, they feel the same way. They're trying to do their best. They're trying to fix the problem. Honestly,
Mm.
if they wanted to make more money, they could go work in banking or something else. Like, I know it's a lot of money to make as an executive, but they could make more somewhere else. So typically, they're not doing their job because of greed. Of course, there may be some greedy ones out there. I don't know everybody, but I'm just saying that the narrative, like physician good, executive bad, is making things worse. And it's a very oversimplification of the problem. So there's kind of this, I think the core of what we struggle with too is that the complexity of being a physician or a healer, the complexity of our knowledge of the human body and of medicine has exceeded, not to mention the ecosystem of healthcare in the United States, for profit, not for profit. Like the complexity level is so high that one human being actually cannot understand it all. So I do this all day long. I can't understand it all. I can barely keep up with the news, right? And this is what I do all day long. So people are really struggling in this age of wonderful advancements in medicine and technology with the fact that like we just can't understand it all. It's impossible. So I think that's very disturbing, and we have this nostalgic yearn for a simpler day. Like when I had a grandfather that was a physician, and he, in the 1940s, went out into rural Pennsylvania with a little medicine bag, and his whole world of knowledge was in that little bag. And I still have his little bag, and I look at it, and he's got little powders, he's got a little syringe, some band-aids, and he literally could go with that little bag and feel like he was doing the best he possibly could for his patients. That is just not the case today. So
Yeah.
I'm kind of giving a bunch of examples, but it's not just exhaustion, which is definitely true. It's also this industrialization of medicine, and it's also the complexity of the healthcare ecosystem we live in today. I think all of those is what's coming together to create this feeling of moral injury, which is, as a clinician, I feel I do things every day that go against my values, whether they're my
Wow.
personal values, my family, religious, or my professional values that I have been trained for many years. I don't feel like I can do the best for my patients. And when those values are transgressed over and over again in a big way, or in a little tiny way, like death by a thousand paper cuts way, then I am wounded and I have a moral injury wound. And then you throw in some burnout and the trauma of the pandemic, and it's a perfect storm. And that's why, we're kind of at where we're at.
Wow. So poignant. I've got book number 3 in the works, right? And it's about leadership. And I had an epiphany on my own burnout. Now, I wasn't in the healthcare field, right? So it wasn't the same, but it was similar. And when I was going through my own burnout, before I quit my toxic corporate job, I was on the phone with my boss and he was yelling at me, of course, because that's what happens, right? And I thought he was the problem until I started to hear noise in the background. And I said, I'm just curious, where are you? And he said, I'm at the pharmacy to get my sanity pills. Oh, okay. So it wasn't just me who was impacted by this, right? He was also suffering. And I honestly, kind of going back to what you were mentioning about the executives are the problem, the executives are the issue in healthcare. That's how it felt like in the corporate world as well. Again, to a different extent, we don't have necessarily insurance issues, health insurance to deal with and things like that, and pharmaceuticals. But there's a injury that happened there. And I empathized with him at that point and realized that he was a cog in the machine. And it made me view him in a different way. He went from being like the enemy to me having empathy for him.
And what
What do you think?
insight that you bring to that. And I think if your boss, my guess is if they had had the mental space and ability to reflect on themselves as
That's
you
right.
did, they would empathize with you and they would probably empathize with their boss who was probably feeling the same way. So I totally, totally agree that corporate culture has a very similar thing going on. I think the differences are that it's much easier to leave corporate culture for another job. In
Right.
medicine, especially if you are very specialized, it is very difficult to leave. Like if you're a pediatric transplant surgeon, there's only so many places you can work. The other thing that's a little different for clinicians is that it's not just a job, it's a professional license. So every time we do something, you know, we can get not just sued, but we can lose our license. And if you lose your license, you're kind of done, game over. Like your career is actually just over. So
Wow.
when you have to do things that go against your values that you feel maybe harming a patient, you could be in front of the medical board and the medical board could take away your license. And I write in my book a very painful story that happened to me that I had a medical board complaint. And this was really scary, Tara, to write this in the book, by the way. I
Yeah.
don't know how much you write in your book, but like this was it's still very painful for me to talk about, but I felt it was important to put it in the book, to be vulnerable, to show that like you're not alone. And sure enough, when I wrote that story, many people have come back to me since and said, oh my God, like Jenny, that happened to you. I can't believe it. That happened to me. I never told anyone. I was so ashamed. So there are a couple differences, I think, with healthcare that make it a little more scary. But totally agree in corporate culture, traditional corporate culture, I would say that the same thing is happening. And so, the question is, where do we go from here? Sometimes I'm very optimistic for the future. I actually think these robot helpers can make a huge shift in how we go to work every day. They already are. Um, and there are cultures that aren't like that. I mean, you can work in places that aren't like that. I think when organizations get really big, they struggle to have a healthy culture, but it's not impossible. And one of the reasons I like early stage companies is it's a lot easier to start from scratch and build something healthy than it is to fix something that's not healthy. But I do think big companies have the potential to make things better. So I guess for leaders, because I know you work with a lot of leaders, um, leadership is not easy. It just isn't.
Nope.
And when I took an executive job and I had to manage a whole country worth of clinicians, it was hard. I never got trained as a manager. Many
Hmm.
people don't really get trained as a manager. I think coaching can be extraordinarily helpful if you're a manager or a leader. Once I got some coaching, it really helped me. But you have a lot of human beings to deal with, and all those human beings show up to work. it's not just Dr. Jennie, the psychiatrist at work. It's like, Dr. Jennie, the mom, the daughter, the wife, the musician, my own healthcare stuff. Like, I show up as a whole person, and every single person that's on your team is a whole person. And how do you navigate that? Like, them showing up as a person and not getting drowned in all of their personal issues, but showing them that you support them. And as a leader, I leaned very heavily on my psychotherapy training, actually, to help me set boundaries and be a good leader. And so I was lucky that I had that training. I don't think you need to be a therapist to be a good leader, but that was the framework that really helped me. And the other thing that about being a leader, which I think is extraordinarily difficult, is the energy that you bring. Like, your boss was yelling at you and bringing some pretty horrific energy to that workspace. You can show up with a really great energy every day, and people will absorb that, and it will matter. But to show up with that energy consistently, day over day, you have to take extraordinarily good care of yourself. You have to be extraordinarily reflective and insightful, and be willing to change your own behavior. And then I think you have to be a little vulnerable. So if you're having a bad day, because whatever is like, your boss was probably in the middle of I don't know if we can cuss on this show or not, but like a shitstorm. Your boss was probably like in a bad day. You can delete that out later if you need to. Like, to be able to say as a leader, hey, Tara, we have a one-on-one today. I have to tell you, I got some stuff going on. It's nothing you have to worry about, but I'm just not 100% at this moment. Would you like to reschedule our one-to-one, or would you like to keep it today? It's up to you. Just being a tiny bit vulnerable
Yeah.
makes it okay for them to do the same. But if you just try to be stoic every day and never show any weakness or vulnerability, you're telling them indirectly that they have to do the same. And so finding ways that are comfortable for you to be a little bit vulnerable. I mean, I've actually, like, I've not like wept on a work call, but I've gotten teary when something is passionate, or I've said, hey, I'm really passionate. You might hear a lot of emotion in my voice today. I'm really passionate about this. It's really upsetting me. And finding those ways as a leader to be a whole person and to be human without putting your stuff on somebody else, right? Like, you don't want to put your stuff on your team. But if you can model that for them, that goes a long way towards making like that psychologically safe space that we all crave.
Oh, I love that. I might have to use some of this for my book coming up, and definitely, this is just, I totally agree with you, Dr. Jenny. You know, a little bit ago, you mentioned that there could be trauma that maybe we, as individuals have unaddressed in our lives. And we talked a little bit about that, and, addressed that very briefly, but I would like to know more, because I've never heard anybody talk about that. So, how would trauma, and a lot of people have past trauma, there's nothing wrong with admitting that, right? I think that's actually the norm, it seems. Maybe you can correct me, but how would we go from, having trauma in our lives, and how would that manifest into burnout like you're talking about? What are some ways that would happen?
So, trauma is a very distinct neurophysiological event that happens in our bodies and in our brains. So, when we have a trauma, the emotional part of our brain um, changes a little bit, and our body can change a little bit. So, there's a great book about, I forget the name, that
Mm,
trauma is stored in the body. But yes, it is, by the way, normal to have trauma in your life. Pretty much everybody has had something in their life that could be traumatic to them. And then the thing is, when that trauma changes your brain just a little bit, or a lot, if it's a big trauma, there are therapies to help your brain relearn the emotional pathways. So there are different kinds of psychotherapies. There's something called EMDR that can help the neuroscience of your brain remodulate back to normal. So if you're fortunate enough to have done a therapy like that, the trauma can actually be, I don't want to say erased, but healed. right? If you don't heal the traumas, they accumulate. And so that's when you start to accumulate more and more and more and more. It starts to become very difficult to modulate your brain and your body emotionally. And that's people also get physically ill frequently
Mm.
because they haven't healed the trauma. And our brain and body are one and the same. Like, you can pretend that they're separate, but they're not. So if your brain is not healthy, it's going to go to your body, and your body's not going to be healthy, and vice versa. So, we think about trauma. When you don't heal from a trauma, whether that's processing it, and some people do it through creative outlets. Some people can process their trauma that way. Some people process it through their faith. Some people process it through friends and family. So I'm not saying therapy is the only way to process trauma, but if you don't heal from that, it will add up. So your boss, who knows what trauma they had built up. And when you do that, you're sucking resources from your brain has finite resources. So when you don't take care of yourself and you have trauma and you're tired and you're not sleeping and you're not eating well, all this stuff just sucks more and more and more and more resources from your brain. And when you show up at work and your brain is operating on 10%, that's when things can really go wrong. Either you mess up at work because you're cognitively not functioning well, or you externalize anger like your boss did and yelled at you, or maybe you internalize it. And that's where I see people getting very depressed, anxious, using substances, and often becoming suicidal. So that internalization, some people internalize, some people externalize, some people do both. So I think about your brain as like having limited resources. And every time you have a trauma, every time you don't take care of yourself, every time you don't sleep, every time you drink too much, all of these things just add up. And once you hit below a certain level, things go wrong. And by the way, as you get older, like I'm getting older, your brain naturally has decreased reserves. So if you're, 35 or older, actually your brain has already started to decline. I'm sorry to tell you. If you want it to be healthy, you're going to have to do proactive things to keep it healthy.
Wow. That you're describing exactly where I was just a few years ago. So I had a lot of unaddressed trauma, childhood things that I had never really looked at, right? And you try to put it under the covers, and what good does that do, right? But so many people don't know how to deal with something, and they just try to push it off. And I understand that. But I had unaddressed trauma, and I was stuck in a cycle of toxic workplaces, one after the other. And my outer reality was mirroring my inward reality. And then what was I doing to minimize any impact of this outer reality? Nothing, right? I wasn't taking care of my body. I wasn't exercising or eating healthy. So it felt like this constant cycle of negativity. And I'm a very happy person, right? I'm a positive person. But the problem is I had these unaddressed things in my life that were continually keeping me almost feeling like I was a record on a record player, just continually going in this vicious loop, right? So I had to change my outer environment. I think that was important. So I decided to, go in to start my own business and these things. But in order for that to work, I had to fix what wasn't working before. You see, it's not just the change of environment, because we can go to a different hospital, we can go to a different corporate job. If we don't fix the thing that was always there, that record loop that was holding us back and keeping us in that perpetual cycle, no matter where you go next, you could have the same result. So I actually worked with a therapist, right, to help some of this unresolved trauma. And I'm really glad I did, because otherwise I feel like I'd be in that record loop forever. What do you think about that, Jenny?
I mean, I hear this story over and over again, and you know, um, I think, like I said, it doesn't have to be therapy. There are other ways to heal, but I would just take away the idea of healing.
Mm,
If you have wounds that are unresolved, If they don't heal, they will fester and they
Yeah.
will show up somewhere, somehow. Body, brain, attitude, something. So finding the way to heal yourself. And I think what's hard is there's not a one size fits all for everybody, and to know your own body and your brain and how to heal it. If you're somebody like me who grew up where, negative emotions don't exist, um, it can take a long time to like figure that out.
Wow.
Um, so a lot of us as adults are trying to, and I don't know, there are some generational things too. I mean, I'm a Gen X person, and if you grew up in the 70s like me, you were kind of on your own. Even wonderful parents were still kind of neglectful by today's standards. We just wandered around and kind of had to take care of ourselves. And so, Xers, I think like me, a lot of us have just put our head down and just kind of said, we'll just put our head down and do the work. But we're aging, and I don't think we can always afford to do that anymore. I'm certainly have gone through that myself, and I've done a lot of things. I can look back now and say, like, that probably wasn't the best thing to do for my brain or my body, but I thought that was the only way. So I think what you're doing, Tara, and hopefully what the book does and others is like, just be a tiny bit curious, like just be a little bit curious about what's going on with you. And if it's really scary, maybe listening to this or maybe reading a book or an art, like find a way that is safe for you to like get a little curious about what's happening to you. Because once you can start to do that, there are so many people out here wanting to help you. There are so many different kinds of jobs you can do. Life can look so different. I have seen this in my psychiatry work over and over. People come to me on the worst day of their lives, and it's such a joy for me to see them on some of the best days of their lives. So I think even though the topic we're talking about is pretty heavy, I do want to make sure we say that there's definitely hope. You are not hopeless. You are not helpless. There are people here to help you. Like you and I've kind of maybe gone through our own stuff. There are therapists out there. There are, religious people out there. There's so many people out here who will help you, but you have to feel safe to kind of open your mind and just get a little more curious and start looking inside, just like in a way that feels okay to you. And that's why a therapist is nice, because that's what they're trained to do, is help you have a safe space to like start that exploration. Sometimes friends and family aren't the best because they're in the dynamic too, and they're not
Yeah.
professionally trained.
Yep.
So that's why a therapist can provide that safe space, because they've been trained. I mean, that's what they do. That's their
Yeah.
training, and that's what they do.
Yes, because sometimes if you tell your family, they're going to say, no, you've got to stay at that toxic job because it pays the bills and all of these things. And then you get the golden handcuff syndrome. Right.
Yeah,
And they have your best interests at heart, Dr. Jenny. I'm not
they
saying they
do.
don't.
They
I'm not
do.
saying they don't, but they don't know what to say. So it's okay to hire somebody who's trained, who's a professional, who you can talk to, who doesn't know you, that can help give you some more informed guidance, I would say, right?
It's very hard to shrink yourself. I tell everybody, I do the same dumb human stuff everybody else does. I need other people to help me when it comes to my kids or my family. I can't shrink them either. Like, I'm too invested in our relationship. It just does not work. So even if you have a family member who's a therapist, they cannot shrink you. You have to go to somebody who is neutral for it to work.
I love that. Well, if this resonates with you, and I sure hope it does, because even if this is something that you've not been through, this topic of burnout, I guarantee you know somebody who is going through this or has gone through this. And my question to all of you amazing listeners today is it burnout or is it moral injury? So I want you to consider that, because, again, I feel like the word burnout has been diluted. But what really is it? And I do believe she is correct, Dr. Jenny, in the sense that it is moral injury causing this. So thank you so much for being a fantastic guest on this show. I loved our conversation. And to everyone who's listening, don't forget to subscribe, leave a review. And share this episode with your friends and audience. We want to spread this word as much as possible because this is a positive podcast that is for transformation. And that's exactly what we have planned for you, is personal transformation. So thank you, and we will see you on the next episode. Take care.